So you may have heard from your doctor that it's pointless to test your hormones during perimenopause, before perimenopause, because your hormones fluctuate. Sure, they fluctuate throughout the month. But the reality is we do know certain ranges that your hormones should be in during the different parts of your cycle: follicular, luteal, your ovulation phase, and your period. So using those reference ranges can really help us to figure out if you're way off of where you should be. And perimenopause is going to throw those levels off for sure. There's several different types of testing. You can do serum testing, which is easy and usually the cheapest option. But the only problem with that is it's looking at your total hormones and not just your bioavailable hormones, which we kind of care more about. You can also do saliva testing, and this is one of the best options in terms of getting that bioavailable hormone levels, and particularly if you can do a full cycling panel, that means taking saliva samples throughout the month, then we can really see what your whole cycle is looking like. Hard part of that is collecting the saliva, keeping it frozen. So that's kind of the cons. You can also do dried urine testing, which is super helpful for seeing not only your hormone levels, but also how they are metabolizing. And that can be very useful, particularly with the estrogen. And it's a pretty simple test to take. If you do the monthly cycle for the dried urine, it's also going to be, you have to keep that frozen and make sure that it gets in there while it's still valid. Finally, there is dried blood spot, which is a better option than your traditional just regular serum. So those are some of the options.